to the Spinal Truth Show weekly podcast edition. I'm your host, Dr. Caleb Slater, and this week we have a special episode. We're here with Amy, and we're continuing our talk on POTS. Last week we talked about POTS and the symptoms and who gets it and what else might cause those symptoms. And now this week we have Amy here to share her journey through her POTS symptoms, diagnosis, and then eventual treatment through the Spinal Truth.
Hi, thank you.
Thanks for being here. So it was about 2 years ago that you started having symptoms. Can you kind of take us back to that time, what happened, what symptoms you got, and what you started doing for it?
Yeah, one night I had woken up late in the middle of the night. We had a new dog that just refused to sleep through the night. So I had gotten up, and the next thing I recall is my daughter at my door going, "Are you okay, Mom?" She's like, "I heard a big noise." Well, I had fallen, I guess I fainted, and hit everything in my room at the same time. So I had a concussion from that. And it kind of led to, I had been feeling like really bad for a while. I was exhausted all the time, kind of equated it to like, your daily stress, like you're working too much. I was just exhausted, like little by little, like life kind of just changed. So after the concussion, I'd gone to the doctor and started talking about like, why would someone just kind of faint in the middle of the night for no reason? And the doctor who, she kind of picked up on it right away, and she started like doing the whole like measuring your heart rate when you're sitting, standing. And she said, I think there's like more to this, and I think we should kind of go the cardiology path, and sent me to a cardiologist to start kind of the testing that led to the POTS diagnosis.
And during that testing, you did the tilt table test, right? Which is the gold standard of diagnosing POTS, and you failed it.
Yes, failed it very well. I failed it quickly. Did that, like the 2-week Holter monitors, like that kind of thing. Racing heart rate, like, it got to a point where it was like, I want to say 6 to 8 hours a day, my heart rate was just racing constantly.
Oh, wow.
I was constantly dizzy, I fainted a lot, but, you could feel it coming on. It was just a horrible feeling. Like I was exhausted. My chest hurt all the time. My head was hurting. I couldn't remember anything. It just got so bad.
And pretty much you're saying all the telltale signs of POTS. There's that brain fog, fatigue, racing heart rate, dizziness, lightheadedness. I mean, these are quintessential telltale signs of POTS.
Yeah, and the pain, like, I don't know if it's just from exhaustion or what, but like your limbs just started aching all the time, so it turned into a lot of doctor's appointments.
So you saw your primary first, and then who did they send you to?
They sent me to a cardiologist who sent me for all the tests, but then quickly dismissed me, like I wasn't sick enough to get help. I was fortunate. I found a cardiologist that had a lot of empathy and like
So another cardiologist, second cardiologist.
Second cardiologist, many months later, many months waiting. The help there's not a ton of help out there.
It's not great.
And lots of people are getting these mystery symptoms, So second cardiologist started treating me, gave me a lot of lifestyle tips, like start the exercise slow, start rowing, start walking, but put me on beta blockers to start bringing my heart rate down. And that did start to control my heart rate, but then nothing got better.
Well, and you said exercising made it worse.
Couldn't even get to the exercising. Like I would start it and I was so exhausted, I'd want to sleep for 2 days, and that's not really motivating.
Well, it's interesting you gave you rowing too, because we'll talk about that a little bit later, because it would be the complete opposite of what you should be doing for if it's a spine generated issue. If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show.
Yeah. After a while, my primary doctor suggested that I go see a neurologist that specializes in POTS, but I think I'm still on the waiting list.
Okay.
And she also sent me to physical therapy to deal with, like, I was still having the concussion kind of brain fog. They weren't sure if it was POTS or if it was concussion.
And how did that go?
They taught me how to faint.
The
Safely.
Falling techniques, right?
Yeah, I mean, it was helpful, limiting,
Sure.
but it helped me identify my triggers for when I was going to faint. And so instead of fainting, I would fall to the floor quickly, wait for it to pass. I hurt myself less, but we went through that for about 2.5 months, and then
Still just behavioral changes, though, to your symptoms, not addressing the underlying cause.
No. Drank lots of electrolytes, spent lots of money on supplements.
All right, so we have exercise, electrolytes, supplements, beta blockers, physical therapy.
Oh, the compression wear was fun too.
Compression wear, that's another common
Hundreds
treatment.
of dollars in that.
Yeah. Did you feel like that helped at all?
No.
Okay. So,
No, and sometimes I think it made it worse, actually.
all right, so not helping. Then what'd you do?
A lot of times I laid in bed. I got depressed.
Yeah, I mean, and a lot of people out there that don't have chronic symptoms, and chronic meaning 3, maybe 6 months or more, it really, and symptoms that you don't see a light at the end of the tunnel of treating, and within a few weeks, months of having symptoms that aren't being managed, that aren't being addressed, it really starts to eat into your life. Like, you're not wanting to go out, not wanting to socialize, having trouble getting the energy to go to work, let alone to do anything extra,
Oh yeah, I think I would work, and I work hybrid, so I'm fortunate that I can work at home a couple days a week, but I would stay in bed until the last possible minute, roll out of bed. You're not working as well as you could be because you're just not taking care of yourself. And then I'd go back to bed. And then Friday would come, and I'm like, thank God it's Friday. And I would go to sleep. And then Saturday or Sunday, one of the 2 days, I had to be in bed or on the couch or something. But, everything piles up around you.
Sure.
It was, I don't know, you didn't do anything fun anymore. Kind of lose, who you are.
Yeah. I mean, and it can,
I'm a lot older than I am.
can easily get depressing.
Yeah.
So the symptoms kind of continued like that. You were managing them, but it sounds like nothing was making a giant dent in your symptoms.
No.
What did you do next?
I'm sure at some point during the kind of laying around and not doing anything else, I read to the end of the internet thinking,
Sure.
there's got to be something else. And did tons and tons of research, and started to look at how, I don't know, I have a compression in my stomach, and I was trying to figure out if they might be related somehow. And that's when I actually came across your page and thought, that looks too good to be true.
Okay.
But
Was it a specific, was I talking about POTS?
no, you were just talking about, dizziness and the symptoms, but it wasn't actually POTS.
Okay.
So I was like, well, I have some of those things.
Sure.
But you talked about how you could, if you were better aligned, if your body was working right, you could start to resolve these things. And I was like, okay, if it was that easy, I would be feeling better by this point.
Yeah, and somebody would have told you by now, right? Somebody
Because
would have
why
mentioned
wouldn't
it.
anyone tell me that?
Now, so when they diagnosed you, were they sure? Did they give you any other differential diagnosis, or were they like, no, this is it, this is what you have?
No, they gave me the diagnosis.
And this is what you have?
Yeah.
They didn't give you any other kind of options, and did anybody mention that maybe it could be a spine issue causing these symptoms?
Oh, no.
No. Okay. And I kind of know the answer because 'cause that's why I wrote my book in the first place, is that nobody talks about this. Nobody talks about how the spine can cause all of these same symptoms, and just nobody looks for it.
Yeah, and I had probably skipped part of the story. Like, I had gone to orthopedic surgeons, like I had gone to pain management, I had gone to chiropractic, and of course they all think there's something, but they gave me a shot. You know, some of it helped, some didn't. Some days I couldn't walk. Like, I went from being totally healthy to needing a cane. You know, it was crazy.
Wow.
Yeah.
Well, and let's fast forward a little bit. We have done 4 sessions together so far. Mm-hmm. That has spanned about 6-ish weeks, I think.
Right.
How are you doing?
So good. Like, I don't know if I would believe it. Like, if somebody was telling me, I wouldn't believe it happened. You know, some of my friends are like, "Are you sure you're not being taken advantage of?" No, but it's true. After the first session, I thought, I don't know, like maybe it was in my head, you know, like maybe I want it to be true.
Sure.
Which I did. But by the second session, like that day I left feeling like pain. But later that night, I was like, my heart rate's starting to go down. Like, I'm not getting dizzy as much. You know, but between the second and third, like there was really a difference. Like I started sleeping a little bit better. I definitely had more energy. I have not gotten dizzy in weeks. Like it used to be 10, 15 times a day. I mean, it was just normal. I really thought this was like the rest of my life. You know, like I just had to learn how to be chronic.
I mean, that's awesome. And it's great to see that change. I completely hear you when you say you weren't sure about it, because I'm saying something completely different, right? I'm coming at it from a completely different angle. You're not getting this information anywhere else. So it's a little hard to believe. It's a little hard to hear after your symptoms have been marginalized or boxed under a category that you spent the last 2 years wrapping your head around. You spent the last 2 years being somebody who has POTS and trying to address that and trying to treat that. And now all of a sudden somebody's saying, hey, might not be POTS. Mm-hmm. Or, by the way, we might get POTS as a medical community wrong. You know,
Yeah.
If you look up the causes of POTS, I actually wrote down some here. It's viral, autoimmune, physical deconditioning, trauma, surgery, Ehlers-Danlos syndrome, mast cell activation disorder, or idiopathic, meaning I don't know why. It's a medical term meaning I don't know why. And a lot of these types of conditions, POTS, PPPD, fibromyalgia, AMPS, they have the same cluster of there's so many possible causes, and a lot of them are idiopathic or anxiety that could cause these symptoms. And basically what that tells me is that we don't really know. And if we don't know, maybe we got it wrong. Maybe we're looking at the problem through the wrong lens. And the area of your spine that was most problematic was somewhere around T2 to T6. It was that thoracic area, and that's where I think a lot of these symptoms come from. And by the way, that's the area of your body that controls your heart rate. It controls your sympathetic nervous system, which if it's activated, it can cause dizziness, lightheadedness, fatigue, all of these cluster of symptoms that you were going through.
I don't even know how to describe it, coming to you and hearing, oh, there's an explanation there. And I was like, okay, we'll see. I'm a very much like, prove it to me person.
Sure.
And you did. I mean, it's really been like I went on vacation and to a very warm location, and I thought like that's definitely a trigger.
Well, and flying too, right?
Flying
and
was
traveling.
such a trigger. I have not had any problems with it. I didn't have to take any downtime from traveling. And just last year, we traveled shorter flight, and I want to say about 50% of my vacation, like my husband and daughter went out on their own, and I stayed in the hotel because I was just too exhausted. And they knew that could happen. This time it wasn't like that at all. I was like, come on guys, let's go. Why aren't you guys getting up? Don't be lazy. And then when I came back, I just got right back into life. I went out last weekend to listen to music and have drinks, and I have not done that in probably 3 years because I've been just too tired.
If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio. And you were telling me, and this is one thing I love to hear, that your daughter and your husband are starting to make comments, right? They're starting to, what were they telling you?
So as much of an adjustment as I was going through, like mentally, like accepting this is your like new limitation, I think they were going through the same thing, you know. My daughter was always nervous. Like she was checking on me multiple times a night. She's 21. That's not a great place to be, you know. So I've been starting to hear from her. I don't know what's going on, but you're not as forgetful, Mom. Like you don't tell me things 5 times all the time. And my husband, you know, I overheard him talking to his father last night on the phone, and he said, I don't know what she's really doing. Like I watch her stretching and she does some things with weights, but it's been life-changing.
Wow.
It's like she's like different. And it's nice to hear from them. Like
Absolutely.
It's nice like to be able to kind of make them feel more normal too.
Well, and obviously you caring for them in the sense of not them having to care for you, but it's also that external validation of, because maybe it is just in your head. You know, anybody watching this, maybe there's a placebo effect. Maybe she just wants to be better. Maybe the medication's finally helping. You know, there's all these possible explanations. But you've been doing the medication for a while and it wasn't.
But I went off of the medication.
Went
for
off
3 weeks. 3 weeks ago, I've stopped taking it completely.
And how's the heart rate been?
Totally fine. Actually better. Actually better. And you know, like I think for some people, medicine's probably fine, but it didn't feel great when I took it, you know?
Yeah, I mean, it always has the side effects. And,
Yeah.
and one of them is lethargy, right? You know, and just that general feeling of difference, change, unwell. Mm-hmm. You know?
And now that's, you know, it's just nice not to have to rely on it.
Yeah, and again, your loved ones pointing out to you and saying like, hey, we're seeing a change, that validation gives you like, okay, well, it's not just in my head. Other people are seeing this. Have anybody outside the family made a comment?
Some coworkers have noticed that I'm not like as tired, you know, I'm not struggling as much. Yeah, I definitely think it. My sister has made some comments that I seem to be like enjoying things more, you know, and like trying to make plans more than I used to. People are definitely seeing it.
Nice.
Yeah.
So let's talk
They're
about.
seeing me actually, because they hadn't seen me for years.
Because you're going out.
Right.
So let's talk about what we did, and we've done 4 sessions. We're going to do our 5th after this. What can you explain the process of what you went through, and maybe how it differs or compares to the other treatments that you've been given?
Yeah, I mean, I think the first real session, you know, you taught me some stretches, things like that, and some really, I mean, they're pretty basic exercises. Now, the commitment to do them twice a day was probably pretty hard, especially
at
when
first,
you don't
right?
like to get up in the mornings.
Right.
I'm not naturally a morning person. So that has definitely been an adjustment, but I noticed when I put the time into it, like I immediately feel some relief. And then at night when I do them, like I start to like unwind for going to bed, and I think it helps me kind of relax to get there.
How much time each day do you think you spend on your exercises?
Probably about an hour
Okay.
total.
And the goal for this program, by the way, is to initially, that's probably around the time that I want. You know, it does take some effort to undo the last 2+ years of symptoms.
Yeah.
But then within around 6 to 8 weeks, now starting to back down. So we're coming up on that. We're getting close to where you back down to once a day. Mm-hmm. And then you continue this, and then within about another 6 weeks, you can kind of do what you want. You know, a lot of people will continue to do it once a day just because they don't want to, they're a little afraid of going backwards.
Yeah.
Or that they've realized that these exercises target the kind of the opposite of what we typically put our bodies through. So they're just a good thing to do. But getting you to the point where you don't have to do these exercises at all if you don't want to. And that's the goal, and that's what I really, like what you said, we're not doing anything special. We're not doing anything, there's no equipment, there's no special techniques per se, and it's something that I try to get across because it's a simple, logical approach that just goes right at the problem. It
really does. And right away. Like, I kind of expected to come to you and probably not come back. You know, I assumed that there was going to be some magical potion or, you know, you need to buy my line of products. And it was none of that. It was just real.
I wish. Every once in a while I try to like just think of something that I could sell because it would be much more lucrative than saying, look, put a little bit of effort in, do it for a few weeks, and you're going to see significant improvement. But because I don't have a gadget I can sell. I don't have a vitamin or a supplement or something like that, and that's a lot easier to market. It's a lot easier as a patient to say, all right, well, I'll do this, and it's kind of passive, and it'll help me.
Yeah, I think, like, you know, the way modern medicine tells you to do things, it's to take medicine, it's
right.
to take a program and get better. And so it was kind of different to hear that's not what you do. And then I think the other key part that you've really helped me understand is I've been working in office roles for 30 years. And so I don't have great posture. I don't have, you know, I work a lot. And you kind of like taught me to start paying attention to that. And, you know, some easy things to work into your day. You know, people will come by in my office and I'm like sitting there with a foam roller on the floor.
Which is awesome.
And it's great, you know, and I feel much better, I think, like kind of just making it part of my day. And I don't know, this is just, I really can't, what you've taught is just kind of invaluable. I really thought I was going to be sick for the rest of my life.
And now how do you feel? Like we've talked after, I think the second visit you came in, you said you were 40% better. Third visit, you were saying somewhere around like 70% better. And I asked you, what's the other 30%? And you said, I'm afraid it won't last.
Yeah.
Now we're 2-ish weeks later. How about now?
I'm giving you 90 today.
Okay. 90%?
Still, I will tell you, I'm scared to death, but I feel like when you say you won't have to do them, like I feel like, no, I can't stop because I don't, you know, like I don't want to go back to that place. But no, I feel really good, you know, and I feel like, you know, I can slowly like start kind of getting back and remembering what it was I liked or figuring out what I like to do in my spare time.
Well, and I love you saying now that you're going out, you're listening to music, you're drinking, you're socializing, you know
Yeah.
what I mean? Stuff that you don't realize how introverted you become when you are sick.
Oh yeah, and it happens so quick.
Have you gone back to any of the doctors?
My primary care, yeah.
Okay.
The rest of them I haven't.
Did you discuss what you're doing with your primary at all?
Not yet.
Okay.
She is very like open to different kinds of medicine. So she did ask me previously to let her know like if I went to different doctors. She also kind of felt like the community was lacking resources. And you know, she said it was kind of sad because you had a lot of people coming out of the pandemic that were feeling this way.
Sure.
So
Yeah.
I have an appointment in a couple weeks, and we were going to talk about it. So I'm
Yeah, it'll be
excited
interesting to
share
hear.
it with her.
You said some of your friends, they were kind of skeptical about
Oh, yeah.
you getting taken advantage of. What have they said since you've kind of gone through this process?
they'll ask me how my TikTok doctor is.
Yeah. If you asked me 3 years ago if I would be treating people and advertising on TikTok, I would have laughed at you.
I didn't even use TikTok till I found your pop-up. So, yeah, they're happy. They're just like, you know, I think they get tired of kind of hearing like, what are you doing? Nothing. What do you expect me to be doing? I'm tired. I faint.
Yeah.
No, I think they seem excited for me. I think they're still skeptical, of course. You know, I've been talking to other people, like when you get to a point of not feeling hopeful, like you tend to build a community of people like that. And so I've been trying to talk to people about what I'm doing. And, you know, like I think it takes a while to accept there could be another option. So I'm trying to build that up in people. I want people to try it.
And it's funny because the patients that work with me and get to the point where you're at, they pretty consistently start adopting this, like, this isn't a great term for it, but like evangelistic approach, where they're going out and they're telling other people, and they're getting the same rebuff that I get of disbelief, or you know, falling on deaf ears, or people just really not, you know, kind of pacifying them, nodding their heads, and the patients get frustrated because they're trying to tell people, they're trying to help people, and it's not getting through. And I'm like, and it always makes me laugh because I'm like, welcome to my world.
You know, I was actually telling my husband the other day that I feel like maybe if I found you like a year earlier, I would have never tried it because it was just
you weren't at that point
to be true, and I was still like stuck in that place of if I could have gotten better, I already would have. And so I don't want to waste my time and money trying to figure out what's not going to work. And so I probably would have just kept scrolling.
Sure.
You know, so maybe you just have to be at that point in your journey too.
I'm pretty much, you know how you said the end of the internet, or kind of the last ditch effort.
Sorry.
Maybe that's what we should change this podcast to. You know, the last hope.
Your absolute last hope. Just try it. It can't get worse.
Yeah. And that's kind of where I pride myself in, because you know, when you have been to neurologists, 2 cardiologists, a primary, a chiropractor, physical therapist, and you're not spine injections, pain management, and when you're not seeing those improvements, that's where I take a little bit of pride, where I'm like, hey, I'm able to help where others aren't. But that's not good enough, because that's not the way it should be. You shouldn't have had to wait 2+ years. It should have come up early on in the diagnosis and been like, hey, let's take a look at your spine. And that doesn't mean imaging, by the way. A lot of people out there, what type of imaging do I need? I'm not a fan of it, for this process anyway. Let's consider your spine as a possibility. See if it's tender, see if it's tight, see if treating it for a week or 2 properly does anything to your symptoms. If so, great. If not, move on. And that's what I want to see in the medical world. And that's the whole point of being here. That's the whole point of writing my book. That's the whole point of us discussing this, is hopefully to prevent people out there from going through what you went through.
I hope it helps someone. I mean, it's such a hopeless feeling. So if someone could just kind of take that chance before the last internet search, I think it would really help people. Maybe not everyone, but I mean, there is literally nothing to lose from trying different approaches.
Well, and that's a buddy of mine always kind of laugh at it, because I get a lot of pushback from this. And at the end of the day, it's what do you have to lose on going through this? You know, it's a little bit of time and it's some money.
Yeah.
But if you try this and it works, I mean, it's life-changing.
Really is.
And even, not to be too hyperbolic, but it's paradigm shifting in the sense that now you're starting to reconsider why my symptoms were there in the first place. What is causing them? What do I do that helps it? What do I avoid that makes it worse? Like rowing.
Yeah, no, you're right. And as we've gone through the treatment, like I often kind of flash back to, oh, maybe that was all connected. You know, you'll think about a pain and I'm like, oh, I did that, and that makes sense. Or, you know, and honestly, like as you lay around and you're feeling bad about yourself, like it gets worse because you're not doing anything.
Right.
So.
Well, but even then, like, so people say being active is the solution, but you tried active.
I did.
And it was making it worse because it was, so for the people out there wondering like what the cause is, for the most of the time, it seems to be a problem in the thoracic spine, causing these cluster, or parts of this as clusters, such as your brain fog, your fatigue, your anxiety, your dizziness, your lightheadedness, your headaches. Those are all, your heart rate issues, they can all be caused by a problem in the thoracic spine. That area has a supply to your, or involvement in your sympathetic nervous system, your fight or flight, right? So a problem in that area can basically set your system up at like resting at agitated. And that'll cause fatigue, that'll cause heart rate changes, that'll cause all the symptoms that I talked about. And the cool thing is that if you treat it and it changes, that verifies where the problem was coming from.
It worked. It's working, I should say, right?
Right.
Yeah, it's amazing.
No, well, and thank you for being here to help get this information out. I'm sure it'll be helpful to the people that hear this and are going through the same or similar to what you've been through, because your journey, honestly, it sounds like pretty much every patient that comes to me. It's primary to a specialist, to another specialist, to physical therapy or chiropractic, back to specialist, to pain management, to kind of losing hope.
Yeah. And I always feel like fortunate, like I have the resources to go to all those doctors, but think about people that can't even get to those doctors. I can't imagine. It's a horrible feeling to not be able to be in control of how you feel.
Yeah, absolutely. Yeah, so thank you for being here. It will help somebody.
Cool. Thank you.
So that's our show. If you want more information, you can look for us on TikTok, YouTube, Instagram, or Facebook. If you want a visit with me, you can go to my website, thespinaltruth.com, to set up a consult or a session. See you next week.